So we are going to move from Marin over to the East Bay to Contra Costa, and Demian Hardman is going to talk a little bit about Contra Costa's Healthy Homes Initiative. And Demian is a senior planner with the Contra Costa County Department of Conservation and Development. He earned his BS in Community and Regional Development from UC Davis in 2006, and shortly thereafter began his career in land use planning with the county. In 2019, he transitioned into the conservation section to design and implement energy efficiency programs and was instrumental in obtaining funding to develop the county's first climate action plan, and one of the first climate action plans with a health element included in it. Since September 2013, Demian has been the county representative for the Bay Area Regional Energy Network and local government partnership, East Bay Energy Watch. Demian, take it away.
All right. Welcome, everybody. I see a lot of familiar faces in the EE space here today, and I also see a lot of faces that are new in the health, which is fantastic. So, let's see. There we go. Perfect. All right. Today, really, for me, is linking health, energy efficiency, and energy code compliance. What we're looking at is a lot of things. And if you were to go back when I first started doing this 9-ish years ago, I couldn't have a conversation in eastern Contra Costa County about the word climate change. They'd look at me like I'm crazy. A lot's changed now. I can go over to that community and they actually know what it is. They believe in it, and we can have conversations about it. When I first started doing energy efficiency, it was just selling the ideas of the benefits of energy efficiency, and had not run into Michael Kent from Contra Costa County to learn about health yet until we started developing our first climate action plan in 2011, where we did include one of the first health elements into a climate action plan. So have learned a lot over the years on trying to connect health and energy efficiency kind of across the board. And we've developed a relationship now to kind of connect those dots more readily with the work I've been doing on energy efficiency. So really, when it comes down to it, we want simple things in our life, right? You know? And when I was looking at trying to connect all these dots, it's really simple. Improved quality of life, improved living conditions, and an opportunity to convene local government so we're not siloed, right? That word has come up several times already, and it's really bridging the gap on different groups that are all trying to do the same thing. Me coming from a land use planning perspective has also helped bridge the gap to educating our land use planners who don't do this kind of work on sustainability, and trying to understand how they all connect as well. So that's been helpful. And that is tied to education. Education is really, really important. And in doing energy efficiency programs just across the board, you really need to explain to the homeowners why it's important to include health and how health connects to all of these things that we care about. And I think the biggest case for me is like children with asthma, parents who have children with asthma, myself who's had asthma my entire life until recently, and we'll talk about that. So it's pretty much been mitigated because of the changes I've made to my home, okay? So when we talk about asthma in Contra Costa County, it's pretty prevalent that it's located, and I only know this because I've looked at enough of these maps, that it's generally located in some of our more disadvantaged communities in the county, and that's the red areas in general. Asthma is prevalent in minorities in general for a multitude of issues. It's housing, it's not access to the right resources in general. It's all kinds of issues. And so how do we provide the correct means to hit some of our population that doesn't even know that they're harming themselves in their own homes, okay? So when you look at asthma here, you see this, and then you see minority populations in our county, and all this can be found on our county's website and our general plan update, because we're updating our general plan. So all these maps are available. There's all kinds of fun maps you guys can check out in our county on that. So, so there you see minority populations. So me as an energy efficiency person who's running programs through the Bay Area Regional Energy Network, that's rebate programs for our single family program, rebate programs for our multifamily program, and also our county low-income weatherization program, which our program manager isn't here today, but Laura Glass does wonderful work for us. And we're a unique organization because in most cases our third party, our low-income weatherization programs are usually operated by a third party. They're actually done by our building department. So our building staff actually does our weatherization programs, and so that helps, and they are dealing with the low-income areas where they don't have adequate housing and they don't have the resources. And so we're trying to connect the dots with all of these different programs, right? So we're trying to bring in our weatherization program, bring in the Bay Area energy efficiency programs, leverage our existing resources with all of those things to figure out how we can roll out a program that meets a cost-benefit analysis to make a case for broadening that to include health elements into these kinds of energy efficiency programs we're trying to put together, and then also do stuff for health, such as air filtration, certain things for certain populations that need those things. Okay, so here's our air quality impacts on health. I actually think it's too general. I think there's a lot of impacts on our inside air quality that's not necessarily addressed here. This is more of an outdoor air quality issue. But it's a good map to look at and see kind of where our key areas of focus should be, just in general. And so I'm going to be really short, but I might talk quite a bit on this one slide. We are working really hard on a business case right now, working with Green and Healthy Homes Initiative. We received a technical assistance grant to put together a business plan to connect energy efficiency and health. And our particular interest is addressing asthma cases in Contra Costa County. It is a #1 priority of the county health department to try to reduce asthma in our county. It's a major air quality issue and major health issue. And so what we're doing is we're putting together the resources to try to put together this business case. So what does that look like? First of all, we're looking at energy code compliance. At the end of the day, we wouldn't have what we have without the CPUC's regulatory requirements of the energy code compliance that's required to put us in place to improve our built environment. The problem with energy code compliance is it's all for new construction, right? So what we need to do is how do we improve the existing homes? And what the energy code does is it kind of says it raises the bar every 3 years when they come out with a new energy code. And so what does that mean for new construction? When we do improvements, it helps. There is a problem with that, though, because the cost always goes up with these energy code compliance requirements. And that is another barrier and issue for these people that are disadvantaged, low income, don't have the resources, already are disadvantaged. So how do we address all these issues? It's a lot to deal with. But the next part of my slide here on EE improvement and improved health is really about bridging that gap with, okay, we have rebates available, we have a low-income weatherization program available, connecting those dots and saying we're going to provide an entry point and we're going to leverage resources we have with our health department. So one of the great things of working with the county health department is they actually have their own health department and they have data. And guess what? I can't get data when I do energy efficiency programs, but I have a whole bunch of cool health data I can have access to, which means where are the exact locations of health issue, people with large asthma cases. We can figure out geospatially where that's located. Guess what? Now I can actually do targeted marketing and outreach through my Bayron programs, particularly in multifamily, and send out letters. And so we're looking at that as a strategy. So we have limited resources on what we can provide for rebates in our multifamily sector. We have a limited budget. So I'm looking at, let's target this particular population. Let's do targeted marketing related to those landlords, educating them, telling them how they can improve their home, those kinds of things. So we have this great data. Now we can use it to do marketing and outreach. So that's one of the entry points. The other entry point is we have case managers in the health department that are already in place, that are already going out to homes and already having to do case management. So now we have that data and they're in place. So how do we connect that with what I'm doing and bridge those gaps? And so what we're working on right now is a business plan that kind of maps out how that's going to look. So how are we going to provide all these different services? And at the front, the homeowner or the tenant probably won't really need to know. We're gonna figure out a way how to get an entry point into the system, similar to what Michelle has already done with Marin. We're trying to figure out how to do that. So we're in the process of putting that together. We're expected to have a business plan figured out by the end of September, I think. And so we're excited about all this. I've been in, or it's a small team of us. It's Michelle, Michael, and myself, and our technical assistance group that meets regularly on the phone and trying to figure out how we can connect all these resources to come up with something that works. So with that said, I know it's very vague and broad. It's because we're still developing it. But I think if you take what Michelle has provided, it's a similar case with the emphasis of asthma, and we're trying to figure out, what resources we can also leverage with the health department. So on the business case side, like for our health department, if they don't have to go out and do emergency visits for asthma and go out and do that, that reduces their cost. So that's a good thing, which means maybe that reduces their insurance as well, right? So if we can do this on a larger scale of like reducing asthma emergency visits because of changing the built environment, then it will we can really leverage some funding through our existing health department and say, health department, can you give us money to do this and actually do something bigger and broader? So that's kind of where we're headed. We don't exactly know how it looks, but that's where we're at right now. So thank you.
Thanks, Demian. I think it's actually really helpful to hear about programs in different stages of development, right? And especially about the ways that you all are communicating across jurisdictions to kind of learn lessons and build on each other's successes.